Good day everyone. Now we will discuss three new drugs approved by the FDA to treat diseases of the reproductive system. The first one we have is bremelanotide with the brand name Vyleesi. Let's take a look on the pharmacokinetics of the drug. The drug is 100% bioavailable after subcutaneous injection. Its time to peak is approximately 1 hour in plasma. The drug is protein bound by 21%. Its volume of distribution is 25 plus minus 5.8 liters after a single dose. The drug is metabolized primarily by amide hydrolysis of the cyclic peptide. Its terminal half-life is approximately 2.7 hours, and its clearance is 6.5 plus minus 1 liters per hour. Now let's talk about the dynamics of the drug. In an open-label ambulatory blood pressure monitoring study of 127 premenopausal women receiving Vyleesi once daily, there was a mean increase of 1.9 mm mercury in daytime systolic blood pressure and a mean increase of 1.7 mm mercury in daytime diastolic blood pressure after 8 days of dosing. The increase in systolic blood pressure and diastolic blood pressure was transient, with a mean peak effect in systolic blood pressure of 2.8 mm mercury between 4 to 8 hours post-dose, and 2.7 mm mercury for diastolic blood pressure at 0 to 4 hours post-dose. The increase in blood pressure after 8 days of dosing was accompanied by a simultaneous and transient mean decrease in heart rate of 0.5 beats per minute. The systolic blood pressure and the systolic blood pressure values 12 to 24 hours post-dose were like the pre-dose value. Our second drug is alpelisib with the brand name Piqray. The pharmacokinetics of alpelisib has been studied in healthy subjects and adult patients with solid tumors. Steady-state alpelisib maximum plasma concentration and area under curve increase proportionally over the dose range of 30 mg to 450 mg under fed conditions. The mean accumulation of alpelisib is 1.3 to 1.5, and steady-state plasma concentrations are reached within 3 days following daily dosage. In adult patients who received Piqray 300 mg once daily in the SOLAR-1 trial, population approach-derived mean steady-state alpelisib for maximum plasma concentration was 2,480 nanograms per ml, and area under the curve within 0 to 24 hours was 33,224 nanograms R per ml. Serial electrocardiograms were collected following a single dose and at steady state to evaluate the effect of alpelisib on the QT-CF interval in patients with advanced cancer. An analysis of clinical electrocardiogram data demonstrates the absence of a large effect on QT-CF prolongation at the recommended 300 mg dose with or without fulvestrant. Our third drug is darolutamide with the brand name Nubeqa. Darolutamide exposure at 600 mg twice daily results in prostate-specific antigen mean reduction of more than 90% from baseline. Following administration of 600 mg twice daily, darolutamide mean steady-state peak plasma concentration is 4.79 mg per ml, and area under the plasma concentration time curve from 0 to 12 hours is 52.82 R microgram per ml. The steady state is reached 2 to 5 days after repeated dosing with food, with an approximate two-fold accumulation. The exposure of the darolutamide and the active metabolite ketodarolutamide increase in an early dose proportional manner in the dose range of 100 to 700 mg. No further increase in darolutamide exposure was observed at 900 mg twice daily. Now let's go to our first drug. Our first drug is bremelanotide with the brand name Vyleesi. It falls under the melanocortin receptor agonist. To be specific, it induces the receptor of melanocortin type 4. Vyleesi is given to premenopausal women with hypoactive sexual desire disorder. Now let's discuss the mechanism of action of our drug. Vyleesi is a melanocortin receptor type 4 agonist. So neurons in the body that express this receptor are present in central nervous system and also in the peripheral tissues of the body. When we activate this receptor, it remodulates the brain pathways involved in sexual response. For example, when Vyleesi binds to its receptor, the receptor will alert the central nervous system and also the peripheral tissues in the body so that the blood pressure of the patient will increase. Blood pressure or increased blood pressure is very important during sexual contact. To maintain the sexual drive of a person, the blood pressure must increase. Now, Vyleesi is very unique in a way that it increases the blood pressure of the patient, maintaining the sexual drive of the patient, or to be specific, for our premenopausal women. Our drug is available in pen with the concentration of 1.75 milligrams per 0.3 ml. So the mode of administration of our drug is subcutaneous injection only. What's unique with Vyleesi is that it is more stable when co-administered with alcohol, and it don't have any issues with US FDA's Associated Risk Evaluation and Mitigation Strategy program. We have another drug previously approved before Vyleesi to treat patients with hypoactive sexual desire disorder, but that drug have many issues when in terms with concomitant administration of alcohol. That is why manufacturer or researcher that made Vyleesi make sure that it is more stable when co-administered with alcohol. And this also made or paved the way for Vyleesi to be the drug of choice now for patients with HSDD. Now let's try to compare Vyleesi with our previous drug, flibanserin. Flibanserin was the first drug used for patients with HSTD, but the drug, just like what I have said, has many safety-related challenges. Most common is its contraindication to alcohol and many associated risk evaluation that was found out after it was made available to the market. But all of these challenges were not encountered when using Vyleesi. That is why Vyleesi now is the more favorable drug to be prescribed for patients with HSDD. So in conclusion, bremelanotide with the brand name Vyleesi is a novel treatment option for premenopausal women with HSDD or hypoactive sexual desire disorder. It may offer advantages over pimavanserin, the only other FDA-approved HSDD treatment for certain individuals. Those using bremelanotide should be advised to follow dosing recommendations to avoid adverse events. Also, further studies are needed to review the use of this drug in menopausal and postmenopausal populations and to determine its place in therapy. For further information regarding the drug, you can visit the following sites. And also, if you want to know further discussions or further informations, studies, and results of clinical trials for this drug, you can look for this journal, Bremelanotide, new drug approved for treating hypoactive sexual desire disorder, Annals of Pharmacotherapy.